Hi, everyone. Thank you so much for coming today to our discussion. Before we start, I will begin with a land acknowledgement. In Durham region, sorry, I'm just going to check my volume. Okay. Before we begin, I'd like to start with the land acknowledgement. In Durham region, where I am situated, many of you might be situated on different lands in Durham region, but I'm currently situated on the lands of the people of the Mississauga Ascugog Island First Nation. I'm thankful to be welcomed on these lands in friendship, and these lands that I'm on are covered under the Williams Treaty, the traditional territory of the Mississauga, a branch of the Greater Anishinaabe Nation, including Algonquin, Ojibwe, Ottawa, and Potawatomi. I acknowledge this land and respect for the Indigenous nations who've cared for Turtle Island, also called North America, from before the arrival of the settler peoples until this day. Most importantly, I remember the history of these lands has been tainted by poor treatment and a lack of friendship. We all have a shared history to reflect on, and each of us are affected by this history in different ways. Our past defines our present, but if we move forward as friends and allies, then it does not have to define our future. Before we start, I'd like to also provide a statement on anti-Black racism. So as you may know, anti-Black racism is prejudice, attitudes, beliefs, stereotypes, or discrimination that is directed at people of African descent. As we talk today, we'll talk a little bit about how anti-Black racism has impacted the lives of Black families, Black children, Black youth. But I want you to take some time today just to think about an ancestor that you may have known or someone in history. Consider their contributions to society. And it's important to note that many Black Canadians have contributed to the structure, the development, the experiences of Canada, but Canada has denied their rights continuously. I'd also like to make a call of action. We support the calls from our fellow Black leaders and organizations to continue to declare anti-Black racism as a public health issue. And we'll talk today as well as how it is a public health issue. Enhance accountability and infrastructure to address police brutality, police violence, and harm against the Black community. To strengthen the anti-racism directorate with a clearly defined, articulated, systemic anti-Black racism strategy. To demand the province of Ontario to continue to allocate protected funds to provide culturally appropriate health and well-being support to the Black community, which also includes our organization, and as well as undoing anti-Black racism and working towards making Black life livable. Culturally appropriate organizations must be given the support they need to be able to continue to provide resources. Thank you everyone for joining us today as we dive into a really important topic, begin our wellness series, which is going to take us all the way into June. And stay tuned for later this evening because we'll also do a yoga demonstration as well.
All right. Hello, everyone. Thank you for joining us today. I'm so happy to introduce Kajenga Wellness and what we do, as well as our panelists for this evening. So before we get to the panelists, I'd like to give you a brief overview of who Kajenga is, what we do, as well as give you the lineup for the rest of our health and wellness activities that are going into June. So Kajenga Wellness Project is a 3-year project funded by the Ontario Trillium Foundation underneath the Family Innovation Stream. The Family Innovation Stream invests in grassroots groups that deliver culturally rooted programs to support and empower parents facing systemic barriers. We are quickly approaching our 2nd year of funding, where we hope to expand upon some of the initiatives that we fulfilled in our 1st year of funding. As Kajenga is focused on building strong families, we have held workshops on topics to help build resilient family foundations. Some of these initiatives include facilitating workshops on co-parenting, mental health, generational wealth, and supporting youth, as well as our family support worker program that has been a successful initiative, and our Kujali Black Family Support Line as well. The goal of all of our workshops is to educate and empower our community. Knowledge is power, and with it, we can develop strong family foundations as a catalyst for strong communities. Today is the first night of our health and wellness series. We're so excited for this series to begin as we are all about taking care of ourselves and our communities. Kajenga Wellness Project Health and Wellness Series is a prelude to what we hope to accomplish at our wellness fair in spring 2023. So without further ado, I'm going to start getting into our panelists for this evening, but hopefully we can provide you with more information on our lineup for the rest of this month later on in the evening. So first, I'm going to introduce Shelley Phillip. Shelley Phillip is an RN, BN, and MN, has been a registered nurse since 1999. She has worked in various nursing roles and units, including surgery, orthopedics, burn and plastic surgery, and vascular access. She has worked at Sick Kids Hospital for over 2 decades and has also been involved in a variety of educational and leadership roles at various post-secondary institutions. She's very actively involved in community organizations and is currently a member of and past chair of the Community Advisory Committee, that's a mouthful, I'm sorry, for EP Link, an epilepsy research program, a board member for Epilepsy Ontario, and as a member of the Data Access Review Committee for the Ontario Brain Institute. Shelley is also the founder and executive director of the Ontario Black Nurses Network, committed to encouraging and supporting professional development of nurses and nursing students. Excellent. And I'm also going to move on to Nicole Perryman. Nicole Perryman is the founder of Ephrata Center for Excellence, which is a family services organization, and the Kajenga Wellness Project. She's a social worker, psychotherapist, and certified play therapist. She provides equity training, parent education, opportunity for low-cost counseling for the community, and supervising students as well. And last but not least, I'd like to introduce Melissa Perryman, educator with the Durham District School Board and previously an education coordinator and director at a private learning center. She is currently teaching grade 4 online students. So without further ado, ladies, take it away.
I'm like the director and the producer at the same time. So my apologies for the delay, and my computer is finicky. So welcome everybody. I will start our conversation off today, and then we will talk about health and end off in education. Again, we welcome your questions using the chat, raising your hand, whatever kind of works best for you. And we also have a Q&A as well. So wanted to start you all off on a poll to make sure everyone's here today and paying attention. Very quick poll. Have you attended a workshop or focus group discussion with Kajenga Wellness Project before? All right, so we've got some newbies. Welcome so much for coming today. I'm hoping that it is a delightful presentation for you and gives you all the information. And a big round of claps for those of our repeat people who've come to our presentation today. We thank you so much for the support. I'm going to share it. Sorry, I forgot. So let's do another check-in, probably a little bit more personal. This one, we're going to check in to see how you are all doing. It is a beautiful day, but there's still so much going on that we have to, that we're experiencing. So it's always good to do a check-in to see how you're doing. And if you don't like my feelings, feel free to add your own and add it in the chat. So how are you feeling today? Overwhelmed, joyful, frustrated, optimistic, anxious, relaxed, or other? And I'll give you a couple more seconds to finish up. And I'll share the results. Thank you for everyone who's voted and participating. Wow, a range of feelings. If you are feeling overwhelmed or frustrated or anxious, I am sending you good thoughts and well wishes and hoping that this webinar today will help you to start to feel really relaxed, especially by the time that we start to do our yoga. Feel free to, for those who said other, to share in the chat how you're feeling. I'm also feeling a little joyful and optimistic today. I'm optimistic that by the summertime, we're back to our normal lives. That's my goal. So let's keep our fingers crossed. Thank you, everyone. So let's get started. We've talked a lot this past year about mental health, and only for good reason. Many times we have come from communities where we never talked about our mental health, we never talked about feelings, and it wasn't something that we were allowed to talk about. And so this is a space that we create that allows you to have the opportunity to talk about your mental health. When I was growing up in a Caribbean immigrant household, we didn't have feelings or experiences. They were told us to ignore our feelings, we were silenced and often avoided. And so after, obviously that's going to create some challenges because we always have feelings. We realize that the lack of acceptance or not being able to accept that we have emotions, is what really drives our suffering. And so if we're able to tune in to how we're feeling and focus on our mental wellness, we can really avoid any crisis or mitigate crisis before they arise, to the point of disease or extreme unwellness. And so that's why we're here today, is to really talk about, how do we keep our mental health in check and how do we take care of ourselves on an ongoing basis. And one of the ways is really just to identify and reshape stigma. So if we are past stigma and at the point of acceptance, it's important to pay attention to your whole self, your body, your mind, and your spirit. And if you ever notice that you're experiencing any changes or challenges, such as feeling overwhelmed and that's continuing on for days or weeks at end, or feeling frustrated, those experiences of maybe crying too much or being irritable or having depressed mood are definitely things that you need to start tuning into yourself. But there's also physical symptoms. So if you start to have like health challenges or difficulty sleeping or eating too much, some of those challenges can also be telling you something about how you're feeling and how you're doing. And again, if you're experiencing issues at work, so your normal day-to-day routine is going to work every day, but you're starting to feel like that tension or anxiety about going to work, or just feeling like I don't really like doing this anymore, just those type of restless feelings, those are definitely some signs that encourages you to kind of just tune into yourself and tune into how you're feeling, and then get the support that you need. And this is something that we definitely can do within our family. I want to take a moment to really, talk about the impact of our intergenerational experiences and how that impacts our parenting with our children, how that impacts even how we take care of our mental health. And by having this knowledge around our mental health or understanding these experiences, it can really help us to be able to shift from, being a product of our experiences or being a product of our feelings, to actually taking the active role that we need to be able to take care of our wellness. When you're caring for your family, I encourage you to be strategic. Be strategic in your parenting, on focusing on attachment, building connections within your family, promoting resiliency, knowing that this experience over this past year has been very difficult for many people, and that our ability to adapt and change those experiences really give us the ability to have resiliency and really promote that resiliency within us. Promoting healthy behaviors within our children, within our family. So all the things that you need to do to stay well and happy and healthy, I encourage you to model that for your children 100%. And whenever you're feeling or experiencing distress, or you're not the same person as you used to be, I encourage you to work through those feelings and get the support that you need, because there's help out there. Sometimes the first step is your doctor or a counselor or even a friend in need who can be able to kind of support you and help you kind of put in perspective how you're feeling and how you're experiencing some of your symptoms. So what is intergenerational experience? I was watching a webinar today, and it talked about, this new science of epidemiology. I said it properly. So epidemiology really tells us that when one generation experiences trauma, that changes the makeup of the genes and it passes on generations. And sometimes those experiences can last quite some time without, changes or being able to modify those experiences. One really good example is, the experience of the Holocaust, an experience of slavery. So very distinct periods where people were oppressed based on their skin color or based on their attachment to a particular region or particular religion, and that experience of torture or being oppressed passed on through generations. And even when the incident ended, we know that slavery ended in the 1800s. Even after that experience ended, the experience of anti-Black racism and segregation and difficulties because of being part of that oppressed group, that continued through the generations, and it continued to create a traumatic impact on generations as they move forward. So even myself and yourself are holding on to some of those traumatic experiences that your ancestors held on, hundreds of years ago. Why is this important today? When you think about how you were parented, how maybe your aunties parented you or your grandparents, and even how they were parented, there is this, line of experience of trauma that they experienced throughout the years in many different ways. And those experiences came out in how they parented you and how you then take those experiences and parent your children. But I'm putting here, a question for you all. Are we not our genes? So even though we've had these traumatic experiences, can we change the trajectory of our past experience and change for our children? Absolutely. And some of the things that I want to share with you today is really going to help to kind of change the trajectory so that you can parent different, so you can have different family experiences, and you can change the experiences of trauma that is passed down over the generations. So a traumatic event is an experience that people have that creates an emotional response. So not everything is considered traumatic for everyone, and not everything leads to symptoms of post-traumatic stress disorder. But because of what's happened over this past year with the pandemic, and it's questioned so much of our experiences, our identity, our health, and even now, even talking about the vaccination, just even, how we see ourselves in the future, it is definitely a traumatic event. And it's definitely created a generation of people who think differently or feel differently because of this experience. As a play therapist, I'm exposed to many children, and many children, talk about, their normalization of wearing masks, or, feelings of anxiety because of what's happening, or even anxiety around, people getting sick. Many children talk about, not being able to connect with other kids. I was speaking to some kids today who have had online school from September, and they don't even have friends that they know or they ever seen before. So it's definitely changed the way that they relate with other people. Um, when we don't have those experiences, or we don't have those attachments with other people, it can definitely shape and change the way that we feel about ourselves and our feeling of safety. Another feeling people have talked about is just being exhausted feeling hopeless. Many, even young people, starting to question, what is the purpose of life? Now that all these things are happening within our country, within our world. And definitely it's important for us to just continue to monitor ourselves and our children to ensure that the impact of the pandemic isn't something that holds on forever. So what is post-traumatic stress disorder? It's after the traumatic event. So when, the experience of the pandemic is over and that we're back to a different type of new normal or a different type of life, some people will continue to have symptoms. So they might avoid seeing people. They might continually re-experience discussions or keep talking about the discussions of what happened in 2020, 2021. They may have negative thinking or mood, thinking, what's the point of being here? What's the point of life? Or just really down people. They may also, be really concerned about themselves, their safety, and their safety for other people. So continuing to, have that hypersensitivity around hand sanitizers or staying clean. Those are examples of how it can be a traumatic event. And if you start to feel that this past year, these experiences are intruding upon your day-to-day life, I really encourage you to get the support that you need. So let's do a quick check-in. We'll do another poll. Have you worried about your family's mental health over this past year? Yes, no, sometimes. Thank you everyone who responded. Wow. So we definitely got no nos. We had a lot of yeses and a lot of sometimes. So thank you so much for sharing. I appreciate you doing so. And it really speaks to that we're all worried about our mental wellness. We're worried about our children's mental wellness. We're worried about the impact that it's having on our children. Absolutely. So we can definitely suggest ways to have a healthy family and really continue to be able to infuse some of these interventions throughout your everyday life. You can really teach mental wellness to your children and to your youth, and by equipping them with some tools in terms of managing and coping with those experiences, it can really help shift their experiences so that they've learned to cope with the challenges that have happened over the past year. I really encourage creating opportunities to talk about the experience, what's happening. I do that with kids all the time when I meet them, just to do a check-in to see how they're doing. But it doesn't mean we have to stay in that topic. So you might choose a 1 day a week just to talk about, any kind of insights or how people are feeling about what's been happening over the past week. And then that's it. You don't talk about it again. Don't listen to the news again. And you continue on with your day-to-day lives. There's a really good book that I love called What to Do with the Problem by Kobe Yamanda. And I like this book because it talks really about, when we're faced with problems, what usually happens, what we usually do. So in this story, it tells us about a young child who realizes that they have a problem. And every time this young child tries to run away from the problem or hide from the problem continues to get bigger and bigger. And it is not until they begin to just look at the problem, and when they look into the problem and see this problem, they realize that there's actually an opportunity within that problem. And through that opportunity, they're able to, achieve something that they really want to achieve or learn something about themselves. And that's the lesson here. With this problem that we're experiencing, or any problem that we're experiencing within our family, within ourselves, within work, there's always an opportunity for us to learn, to grow, and to be able to solve the problem in a different way. And it's important to realize that, by running away or avoiding the problem really doesn't make a difference. It just makes it get bigger, or it just doesn't go away. We really have to take the time to face the difficulties and challenges that we face within our lives. But note that we're never alone, that there's always people out there who can be able to work with us to be able to solve the problem. And these problems also give us opportunities. So by exposing ourselves to the possibility of being able to deal or manage with this difficulty, we can definitely have the opportunity to see success in our future. When our mental health is cared for and we pay attention to how we begin to feel, we start to feel acceptance. And once we accept that our feelings are real and validate this process, we can actually begin this process of learning to let go and to hold on to what we can control. We look beyond what's happening in the present moment, but we focus on the reasons for being here and that next moment when we're back with visiting family and traveling and seeing different places and being back into the classroom and other spaces. We learn to accept that spending time working through our emotions and our difficulties actually can help us find solutions. And if we're able to then reduce the intensity of that emotion. So, yes, we may feel sad, but there's things that we can do to help us lessen that feeling of sad. And maybe that might be connecting with a friend or doing something in nature that can provide that support to ease those emotions. We really begin to find solace when we start to work together as a family who also support each other on their journey. And in this way, we begin to grow. Emotional intelligence is really something that people develop over time, and it's a skill that many people have to achieve or develop. It is a skill that helps us within our workplace with dealing with, difficult managers or bosses or colleagues. It also helps us with dealing with our children and challenges that may happen as they become older, especially when they're teenagers. But emotional intelligence helps us to learn the importance of validation and reflecting feelings, because when we feel validated, then we're able to accept our feelings. We can model and reinforce healthy coping strategies. So when you feel frustrated or upset, using some coping strategies that you're modeling then for your children or for other people in your household. Teaching your child to see other people's perspectives. That is definitely a skill. Many times kids don't have the ability to see another person's perspective. And so by teaching them that skill, it can help them to be caring and loving towards other people. Teach your child how to forgive and how to show empathy to other people. Empathy is being able to be in someone else's shoes. And many times it's hard to be in someone else's shoes. We often try to fix things or make things better, but being in someone's person's shoes just really means that you're attempting to connect with them. And through that connection, it really helps people to feel better, reduces their emotions or difficulties, and helps them to feel that they're supported. This next slide really talks about the importance of being resourceful, and resourceful in the sense of, creating opportunities to be able to adapt by being inquisitive or inquiring into a thought or a belief system that your child might have, so they can examine those helpful and unhelpful thoughts. A couple weeks ago, a little girl was sharing with me that she was having a really hard time with a spelling test, and when she wasn't able to get the word, she kept saying really mean things to herself, like, you're not smart enough, or you can't do this. And I said to her, when you say those thoughts to yourself, is it helping you to finish the test, or is it unhelpful? It's making you not motivated to finish the test. She said it was unhelpful. So I shared with her the importance of, instead of, focusing on unhelpful thoughts, what is a helpful thought that you can say that will encourage you to do well on the test, or that will encourage you to stay with it? And then she was able to think of unhelpful thought. That kind of inquiry, I'm not telling her how to feel, I'm not taking away those feelings, I'm helping her think about a different way of thinking. And that alternatives allows people to think of two different possibilities. And there's not always one truth. There's not always one thing that's important. There's always going to be an alternative, a different way of thinking or looking at things. And the final is, teach your children about faith, about belonging, about the importance of connecting with other people, the importance of being kind and caring with others. And by doing so, that they are reinforcing that they're going to receive those kindness themselves from other people. A really important part of resiliency is creating resilient and healthy communities. And sometimes that can be difficult if you live in areas that may not be safe, but there is definitely ways that you can build connection within your community, whether it is, doing something kind for your neighbors, or cleaning up the community or the neighborhood, being involved in your child's local activities or child's school. Those type of activities really helps foster a sense of belonging and helps your child and even yourself to feel part of that community. And when you feel part of a community, you feel that you belong. And then that drive to be able to give back or to support that community is part of us. And obviously, when we do things good for other people, for an environment, it also makes us feel good about ourselves and our abilities, and does lessen that experience of anxiety or depression that we may be feeling, or even just being overwhelmed. And another important aspect of healthy living and resiliency is just that those connections. So being able to connect with others, to share emotionally with other people, and those connections really can help us through really difficult times. Over this past pandemic, having, really good times with my daughter, with my sister, has really helped to keep me grounded through the difficulties that have happened. Even starting a new organization and doing some of the positive, connections through people have really helped to inspire that feeling of belonging or feeling of purpose. So it doesn't feel like I'm doing the same thing over and over every day, but it feels like there's purpose and there's meaning in what I'm doing. So it speaks to that importance of healthy connections. And it also teaches us that even though in some relationships, it may not always be sunny roses all the time. There's going to be some conflicts and challenges within relationships, but having the ability to work things out and to be able to agree and to disagree, and move forward from difficulties can really help to grow and nurture relationships. And before I have some questions, I have, some other thoughts that came up to mind in terms of things that you can do to build resiliency within your children, and different activities that you can do within your family to help them grow. Some of the great things that I love is, being able to connect your child with mentors. So having a mentor in the community really gives them someone to look up to, gives them a sense of purpose. And there's one other person that thinks your child is amazing. Being able to encourage your child about why the reasons of life is worth living. I had many conversations with teenagers who question the meaning of life. Why are we here? Why is all this stuff is happening? And really that existential crisis really comes because of this experience of the pandemic around what's the point. Create that point for your children. Give them something to look forward to, give them something to affirm to them. What is the reason for us being here? And how is it important, even 100 years down the line? Because as I shared before, things that happened 300 years ago continue to impact us today. So that never changes, that butterfly effect. I wanted to take a pause for any questions. We are definitely going to send a copy of the recording will be posted on our YouTube page. So thank you very much. And any questions, feel free to ask as we go along. I'm just gonna wrap up. So before we end, wanted to kind of, count us down to the next part around some of the things that you can do right now within your families is a gratitude checkup. And it's an opportunity to allow us to practice gratitude. By practicing gratitude, it helps to release some of the worries and anxieties that we have and focusing on the here and now. And then there's Genius Hour. I found this out watching the news the other week, where this parenting expert was suggesting spending 1 hour a week where your child can engage in any type of learning that they want to do. using a scheduled time. The sky is the limit, can be anything they want to learn, and it gives them an opportunity to inquire into doing something new and different. The other one is play. If you can spend some time with your child and just play, and not even get into screens, it gives that opportunity to kind of create some inquiry with your child and to help them to be able to discover something new about themselves or even just have fun. So I want to do a quick poll with you before I sign off. Based on the strategies that I shared with you, gratitude, genius hour, finding time to play, or something else, what are you going to commit to over this next week? Great, thank you so much. It looks like a lot of you will be doing some gratitude practicing, so thank you very much for sharing and playing. I want to hear those stories of you playing and anything else you can think of with your family. Excellent. Thank you so much. As I wrap up, I just wanted to go over promoting a resilient family culture. And this really talks about the importance of culture within the family. You know, many times, because of what's been happening over the past couple of years, our culture has changed, our identity has changed, our values and beliefs have changed. But being able to reaffirm and reestablish those values within the family is really important. And some things can look at, recreating family traditions and rituals, developing a family motto that stays with that family and follows the family along their way, creating times for conversation with each other and just connecting and building relationship, and of course family meetings. So by promoting a culture of values, it really provides an opportunity for the family to have something that kind of brings them together and distinguishes them differently from other people and other families. So if trust is really important to you as a family, then it's something that you promote within that family around relationships with each other, or whenever there's difficulties, the importance of reestablishing trust with each other. And it's really an opportunity to get the family engaged into being able to develop those. Creating opportunities to connect, because we do live busy lives. Even before the pandemic, life is so busy, and we didn't always have a time to connect with each other or just get to know each other in a different way. And we really had the opportunity to do so this year. And so continuing to create those opportunities to connect as a family will really help to solidify the family together. And use it as a structured time, something that you continue to do, like every Sunday for Sunday dinner, or Friday nights or family nights. And that will continue to strengthen the family bond, regardless of what happens. And lastly, but most importantly, is as our children are getting older, as we are, aging as well, we want to be able to create opportunities for independence with our children. And that independence would really help them to grow as individuals and as people. And definitely creating new and healthy patterns within that family. So thank you everyone for hearing me speak, and look forward to introducing Ms. Shelley Philip Laforet, who will talk to us about health.
Hey, hi everyone. Thank you, Nicole. Thank you, Kajenga Wellness Project, for inviting me. I'm really excited to be here and speaking to this group. Is my sound okay?
Yes.
I'm assuming. Okay, thank you. So I was listening intently while Nicole was speaking. I'm really excited for the tips that I learned along the way. I am one of those people that said I'm going to play this next week, so I'll let you know what that looks like. In our house, we try to take moments to do that and take time for ourselves as well. So I learned a lot. Nicole was a guest speaker at one of our events as well, and it was great just for listening to how all these amazing tips for our children and for ourselves too. So I thank Jasmine for going through the lovely bio of, that I had. And I do want to say that I founded Ontario Black Nurses Network this January. We started with 1 member, then 3 members, and we're currently at 50 members. And there are Black nurses and nursing students who practice in Ontario, and the purpose is to support, encourage, and develop with each other. And the reason that I found that this was an important thing is because, like what is happening here with us all coming together, is that in terms of health, literature shows that your health outcomes, so the ways that patients react to getting sick and recovering from being sick, it's improved when you have people who look like you helping you through that journey. So I think it's really important that we bring together practitioners and nurses who work together to help improve the lives of those in our community as well. So we have members who span all across all sorts of health industries, and we're really excited as to where that's going. So I'm really also excited to be part of this too, because it's a great opportunity to make another mark and to help people within our community improve our health outcomes. So Nicole is controlling my slides for me, so please bear with me as we sort of do this in tandem. So the first thing I wanted to talk about was health concerns in the Black community. I'm sure many of you, we experience it, we see it, or we know it. Either we have it or our family members have it, or we know that it's something that's kind of going through our families. So the first one I wanted to say is that we know that diabetes is very rampant within the Black community. Actually, yeah, Nicole, just go through and put all of them up. That would be great. I do want to say that I do not claim that I'm an expert in all of these fields, but what I do claim that I am is a willing participant to gaining knowledge, to sharing knowledge, to participating in arenas where we can commune and learn from each other and to grow our body of knowledge. So definitely what I'm going to share with you isn't just from me, but I can also show you resources as to where you can get that information. And I think as a nurse, that's very important for me to make sure that that teaching is happening so that we can grow. Now, when Nicole talks about just our intergenerational experiences and the things we've come a long way from and what we're still dealing with too, it's really important that we know the resources that we have available for us. So definitely you can reach out to me after this talk. Nicole can provide my contact information, and I can help steer you to some excellent resources for this information, okay? So when we look at this board here, where I have all these health concerns, and these are sort of the top, I'd have to say the top 7 right now that I think really afflict Black communities. You know, there are reasons why, and there are reasons why they are persisting. So definitely we know that diabetes, and it's type 2 diabetes, which is the one that's more influenced by obesity and our diet. And, you know, we are predisposed to getting diabetes. It can lead to problems with, you know, eye damage, all sorts of nerve damage, but they do say that it is prevalent in the Black communities. Obesity as well, and some of that is stuff that we've brought along the way over years and years of our amazing diets, the things that we eat that are so exciting and rich in everything that we shouldn't probably be eating. You know, that sort of lends itself to our prevalence of obesity within our community. We also are prone to hypertension, cardiovascular disease, and stroke, cancers, you know, prostate cancer. There's actually a high prevalence of prostate cancer in Black men. All of these things are things that, you know, we would, it's not to say that other communities aren't suffering from them, but there has been literature showing that there are higher numbers within the Black community. So it's really important that we understand the things that kind of impact us greatly. And as I said, if we took a poll, I'm sure many of you can say somebody in your family that is afflicted with this or dealing with this right now, or maybe it's even yourself. Now, I did put chronic stress, and I think that listening to Nicole's talk earlier, that we can understand why the Black community is prone to chronic stress. We trauma. We are living through generations of parenting that has evolved based on that trauma, as Nicole was talking about too. We are living through times right now where there are heightened responses, you know, with things that are going on in the media and happening throughout the world. You know, even though Canada has a more polite racism, I guess you could say, we still have events that are happening to us here that are affecting our stress levels, and it's that repeated chronic stress that we can say leads to physical ailments. So of course, you know, many of our mental health partners would say that when you're not taking care of your mental health, that it does impact your physical health, and it can lead to these things. Now, of course, living through a pandemic right now, we know that COVID-19 is very, very prevalent, and there are numbers that are showing that there are large numbers of racialized people who are being afflicted with COVID-19. Part of that, the research is showing, because we are working in the industries that are more frontline. There are more people who are in frontline positions, and so your exposure, your risk factors increase too. And we combine that with our health concerns, and we are at a higher risk to catching COVID. So during this time, I did want to just say a little bit about COVID. We know that it is spread through respiratory droplet. We're going to talk a little bit more about that, but that can be spread through coughing, sneezing, breathing, talking, anything like that. And we know that some of the symptoms can be very evident. You can see them, you know what's happening to you, but it can also be sort of quiet symptoms that you don't realize that you may have it, and you can spread it to others. So we do know that for Black communities, there are higher numbers. We are we need to be aware of this, and we need to think about what that means for us when we're engaging with the healthcare system, when we're also trying to support each other in various forums. So next slide. So when I was talking to Nicole and Melissa just about what would be great to know about, I think we said that right now we're living through unprecedented times with COVID, and I think it's very important to understand how to take care of our health and how to manage what's happening around us. I think this is a great forum where we're learning about how to take care of our mental health, and I think also it's important to know about how to take care of our physical. The conditions, chronic conditions that the Black community can be faced with. And then we look at the risk factors for COVID. You'll see a lot of overlaps here. So definitely, you know, when this all started, there was a lot of talk about afflicting older people. And we saw, unfortunately, unprecedented numbers of COVID in our long-term care system among our older populations. Great care was taken to combat that as quickly as they could, but definitely we know that COVID impacts you as you get older a little bit more. Now, working in pediatrics as I do, we did see children were being affected as well. However, children's symptoms were a lot milder, or they didn't know that they carried it, and they would then be passing it on to the other adults that they're engaged with. Definitely another risk factor is individuals with chronic medical conditions. So as I said, diabetes, hypertension, and stroke, we are, as a community, we're prone to having those. And so, you know, it's a perfect storm if we add COVID to it. And I think it's just recognizing sort of what we are being handed and what we have to deal with will help us to improve our health outcomes. Anyone who's immunocompromised, is like with cancer, and definitely the obesity. So when you think about my other slide and this one as well, you can see the overlap does predispose us to what sort of the Public Health Agency of Canada says are high risk factors. Are there any questions for right now? And I will have opportunity for that.
I don't see any questions.
Okay, so the next slide I just wanted to say is our COVID numbers. What are the current COVID numbers in Ontario? Now, these are May 2nd numbers, but I do have some updated ones. So we have, as of today, 483,000 cases in Ontario. So it has increased. We've had 82,000 deaths as of today. The hospitalized, I didn't get that updated number, but 1,900 as of May 2nd. And definitely what's really important to recognize is that there's a growing number of variants of concern. So I'm sure if everyone is following along with what is being shared from the Government of Canada, from the Public Health Agency of Canada, that these variants of concern are the ones that are taking over right now. And so we have to be really mindful of how to minimize transmission and, take care of ourselves during this time. What is really important to know is that when the numbers that are being shared in the news, and I think that it was a great thing that Nicole said about just if you're looking at the news, watch it maybe for one day and then turn it off, because if you listen in the news every day, every hour, something changes, something is different. And I think that that can contribute to your psychological health. And it's really important to sort of shut that off and just check in every once in a while, because the numbers don't report how many people have actually recovered from COVID. And I think that's really important, is that those numbers are important to know. So when we have 483,000 cases in Ontario, there have been 440,000 cases recovered. So I think that that's a really important metric to know, and I don't see it shared very often in mainstream media. And I think it's really important for you to know that there are people that recover from it. And I think that if that's something that is worrying yourself, your children, that it's really important to know that that there are people recovering. There are people coming out of the hospital, out of the ICUs, and that's really important to do too. And if you do want to check in on the numbers, the Government of Canada has an excellent website that you can go to, and I can share that a bit later. And you can definitely see what the numbers are on a day-to-day basis, or even across Canada, if you wanted to sort of keep abreast of that. But definitely don't check it every day. I think it's just something to know that those numbers are out there, and that's sort of where we should go. There's a lot of talk on media, and there's a lot of stuff that isn't science backed, and I think it's really important to make sure that you've got a credible source when you're looking at how to prevent transmission and take care of yourself. Okay, so next slide. You can just click them all on there, Nicole. I was getting fancy with the animation, so I'll do it. So preventing and staying healthy during the pandemic. So we know we've probably seen some of these signs all over the place now. What's really important is washing your hands, and washing your hands properly. So, it's the 15-second, it's the singing happy birthday while you're doing it, and making sure that you are really washing your hands. Hand hygiene is probably the best way to minimize transmission of anything. So it's really important that you wash your hands, keep your hands clean. Definitely, we know that there's practicing social distancing, and we see these signs all over. And now everyone could probably tell you how far 6 feet is, because that's how far we have to stay away from each other to minimize transmission. And that's with the mask on. So it's really important for people to understand that respiratory droplets don't discriminate. They don't pick who they are going to jump into or not jump into. So it's really important that we apply all of these ways to stay healthy and prevent the spread. So the 6 feet guideline seems to be a manageable and reasonable guideline, and I know you've seen this all over the place. The other thing in the bottom corner is the Canada Alert app. So there is on the Government of Canada website, there's amazing updates, as I said, there's amazing tips and strategies. Definitely, there are lots of ways that you can self-monitor, and it's really important that you think about how you're feeling, you monitor yourself, you monitor your children. I know you've probably all had to do some sort of screening somewhere now, because it's standard at anywhere you go, right? Just to be able to monitor. Even going to the grocery store, they'll ask you to monitor and have you had any of these symptoms, and whether you've traveled outside of the country and all these things too. So it's really important that we take an active approach in self-screening and making sure that we are feeling healthy before we continue, or we may be carrying something or feeling something as well. So just make sure that you, if you have any questions about how to self-screen, that you can definitely go to the Government of Canada website take care of that. Sorry, can you just go back a second, Nicole? I think I'm almost I have a couple more slides. I am excited about the yoga part because I did see her as well, and I think it's a great way to round out this wellness seminar. So the other thing I want to say is there is a picture about how to wear a mask properly, and there's a term that one of my colleagues used, but I can't repeat it in a public forum, as to the people who wear their noses out and the masks right underneath. And I'm going to tell you from whether you took biology or not, that your nose and your mouth are connected. There's no barrier between it. So not covering your nose, you might as well just not wear a mask, right? So you have to cover your nose and your mouth at the same time. All right, so that's what those pictures are telling you. Please make sure, if you see somebody, I have run into people where I've mentioned to them, can you please pull up your mask? And they seem to think that anatomy has changed. But as far as I know, and until we hear more, they are connected. So you're not doing yourself any favors by having it under your nose. I do say that there are many of us who work in healthcare facilities that have to wear a mask all of the time, and it can be draining after 12 hours of having to wear a mask. We ask that you, in the public, wear it for a few key moments, and when you leave your house and come back. And sometimes it may feel uncomfortable, but trust me, we are doing it and we will get through it. We'll get through it faster if we're all active participants in prevention of transmission. And the last thing on this slide is, I was going to say, please follow the public health guidelines. So definitely on, Government of Canada public health guidelines. Yes, they may feel like they're changing every day, but that's as we learn more, as we see more what's happening in our areas, the public health guidelines will change. But please follow them. Now, of course, the latest is that, getting vaccinated, and we're going to talk a little bit about vaccines and the hesitancy of the COVID vaccine in the Black community. But definitely, we want to make sure that we follow the public health guidelines and we start thinking and talking about COVID vaccines. The next slide. So does anyone have any questions right now? I don't know if I can see the chat or.
No questions in the chat or Q&A.
Okay, great. So do have a quick poll. We'll see how it navigates on Nicole's end, but it is, now I want to say that the question is a very personal question. You choose to answer or not to answer, that's okay. And so if you can put the question up for me, Nicole. So it's just checking in. So will you be getting vaccinated? So yes, no, already did, or not sure yet. So if you wouldn't mind taking some time, what's great about this is it's totally anonymous, and we'll see what the results are.
Sorry, my computer is so finicky.
It's okay. That's okay.
I'm trying to
So
move the icon. Okay. All right, here we go.
Have the results. Okay. So that's amazing. Thank you for everybody who participated. A quarter have gotten vaccinated, or yes, and already did, kind of the same thing. But even just, it's great to see that no one has said no. Now, we will talk about, because there are people that are saying no, we'll talk about that in the next slide. So thank you. Next. So it's interesting. I will say that very timely that there was a news segment on CNN last night that it was just interesting to gain this insight, and I thought it was very timely for what I was going to talk to you guys about as well. But apparently there were these in mommy groups, so online mommy groups, there is a pressure to not get vaccinated if you're an anti-vaxxer, and just sort of the way that social media is driving people's decisions to and it almost like peer pressure to get vaccinated or not get vaccinated. And if you did that, you're almost stigmatized and ostracized for doing so. So again, I would say that when you do have any hesitancy, going back to public health guidelines, going back to reasonable scientific sources, checking in with healthcare providers so that they can help you access the proper resources. I think that that's what's really important. When you encounter people who are also hesitant too, that's a great way that we can help build our community, is sharing with them the people that they can access, or sharing with them the resources that they can go to. So I commend those of you who have gotten vaccinated. I do work with people who are choosing not to, or people who are very, very hesitant and or don't want to share, and that's okay. It definitely is a personal decision. There are people who cannot get vaccinated, but for the most part, we want to ensure that as many people do, and according to the public health guidelines. Now, in the Black community, of course, we know there's been vaccination hesitancy, and it's a great way to reflect on why and what's the basis. So if you knew this already, I'm sorry for repeating it, but I think it's really important that we recognize what has happened and what may have contributed to hesitancy for why people are not or don't want to get vaccinated. I can't say that I didn't have some of the same feelings at first. I am partially vaccinated right now. So I've gotten the first dose, and I think that it's understanding, as Nicole was saying, just sort of our history and things that have really impacted us historically are what's shaping us now. So if you haven't heard about the Tuskegee experiment in 1932, in the States, and experimentation was happening with Black men, and they weren't told about the proper purpose for they were sort of given placebos for syphilis, and just I wanted to say sort of the it wasn't as informed consent as we would have thought it should have been, and so people were misled into not getting proper treatment for their disease. And so that is sort of something that does sit with us and kind of comes along the way. It's like, are we being told the truth with vaccines? Are we being told exactly what's happening? Are we being experimented on and don't know? Historically speaking, Black people have been known to, they used to think that they don't experience pain in the same way, which is why this all erupted too, is that it would be okay to experiment on Black people because they're not going to feel it as much and it's not going to hurt as much. And so of course that's been discredited along the way, thankfully. And but some of these remnants, as when Nicole was saying, the trauma, it didn't happen to us, but it happened to those before us, and it kind of follows us along the way. So it's really important to understand sort of where some of this may have started. The other picture in the middle is actually a residential school in Ontario. So the reason I put that is for marginalized communities, there can be instances where it's so impactful, and it can drive so much, cause so much damage, that we realize those are the reasons why we have to keep talking. We have to keep sharing our educational wealth and making sure that we know what people have been through and where we're going to go. And I love that Nicole, with land acknowledgement and just talking about, you know, where we are and how relationships weren't always friendly. I love that portion of the acknowledgement. And I think it's understanding that, you know, in residential schools, there were medical experiments being carried out on the children that were there. And so recognizing that that was happening, they were, the study that was there is they were intentionally malnourishing the children in the residential schools. It's the same thing. It's you're taking a vulnerable population and sort of expecting them to be okay with what you're doing to them, and recognizing that that survivorship happens and then you pass it along to other generations. So I think it's really important to understand that's where the hesitancy can exist in any marginalized or racialized community. And finally, the last picture, I was just, you know, with being inspired, is of Shirley Chisholm. And so in 1968, if you don't know who Shirley Chisholm is, in 1968, she became the first Black woman elected to the United States Congress. And the reason I put this quote about her is that, you know, it says, if they don't give you a seat at the table, bring a folding chair. So I love that for the fact that I kind of try to live by that now, is that we may not be at the table right now, but we're getting there. And I think the way that we're able to get there is as a community through forums like this, where we pull together what we know, how do we share it, how do we grow and get stronger together so that we can be at the table. And in terms of the hesitancy with the vaccines, I think it's really important for us to realize that in order for us to help facilitate change, we have to be involved in the change too. So that's where I think I commend all of you for showing up tonight. I commend, you know, for everything that we're learning about today and throughout the seminar series. But that's why I wanted to put that. So if you have people who are hesitant still, not just about vaccination, but, you know, about what we're going through in the pandemic, you know, it's really important that you bring them to the table, you take your seat at the table. And like I said, if we're not sitting there, let's bring our own chair and let's sit there too. Okay. And that's it. Thank you very much. I hope that this was helpful for everybody and that we're going to get through this pandemic together with all the great tips that we're learning today.
Thank you. What a beautiful presentation. Thank you so much. And I am excited to introduce my sister, Melissa.
Hi, everybody. It's just really good information so far. Thank you so much, Shelley. That was phenomenal. Just really good to hear a medical perspective of what's been happening, and awesome. And Nicole, you took some of my points, so this will be good. So I am talking about navigating the education system and kind of building resiliency in children. I won't talk too long, but just some things that you may not have heard before and going through them. Next slide, please. So I just wanted to acknowledge that racial trauma is real and children do experience the racial trauma. So, and some of the behaviors that we see in the classroom could be a reflection of that. So this can be directly or indirectly. So as everything was happening with George Floyd, students were talking about it. And I heard from one of my colleagues, her daughter, one of the students, they were making jokes about it, right? Really inappropriate, off-putting jokes about that incident. And so these children are experiencing it. So it could be very directly or indirectly, like just forwarding a joke to a friend. They are feeling the effects of the racial trauma. And I just wanted you to just be mindful of certain signs. So sometimes if they're changing in their play or their academic performance, if they're reverting to younger behaviors, if they're reluctant to attend school, there's bullying, they're feeling withdrawn, decrease of self-esteem, I spelled that wrong, increased anger, worry, fear, they can be experiencing that racial trauma. And it's just important to note. So we experience it, but sometimes the kids who don't have words to express what they're going through can also experience that racial trauma. So I just wanted to take a moment just to let you know that it's real and just check in. Always make sure you're checking in, especially when watching the news or even when things come out, seeing all these things, checking in, because these children are feeling it. They know that they're different. If they are brown skinned, they know that, right? They know that in the classroom. They know that when they leave the house. Next slide, please. Next slide. Oh, so I put some tips that you can do to help support like your student. And one of the things was being very consistent and keeping a good routine. I do the same. I teach online. I've been teaching online since September. So my students have been very consistently online. But every day, and this is, I think, our 8th month, I'll be asked, what do we do next? And every day we do the exact same thing. We switch it up a little bit. I'm not that boring, but every day they're like, what's happening next? Or we'll do one subject and like, are we doing math next? There's always looking for the next. They're always trying to anticipate what is happening. So I'm like, we have our strategies, you have your tools, you have your schedule. I've posted what's happening, but they always have that heightened sense of what is coming on next. So even with your kids at home, just making sure that you have routines, and routines make them feel safe. And even if you deviate from the routine, so if there's a surprise coming up or you're watching a movie on Friday, giving them time to plan, giving them time to prep for it is essential, because they're constantly just unsure of the environment, always wanting to know, what are we doing? What is happening next? And like giving them the opportunity to see the schedule, to see things so that they can make predictions. So they can go and say, okay, oh, next on Fridays we have movie night, or on Saturdays we do family time, just so that they are aware of what is happening next, especially right now where everything is so uncertain. It's the pandemic. We're in school, we're out of school for some. Having something consistent for the students, for your child, really, really helps. And also leading by example. So if you're having a hard time dealing with the stress and anxiety, definitely your child is going to have a hard time too as well. A lot of my students who are online school, some of their parents experience a lot of anxiety, and I feel it in the students. I feel it when their parents email me. I feel that anxiety through the technology, through digitally. And I realize, I'm like, you know what? We need to do some strategies. So I always try to do mindfulness. We work out as a class on Zoom every day. Just going through the tips that were spoken about earlier to really help negate some of that stressors, and really help them feel at ease, and leading by example too. So my tech will be finicky. My screen will crash, or I won't have the right tech up, and just saying, oops, it is what it is, right? Because that creates a lot of anxiety for students in themselves. And when I laugh about myself not spelling words right, like my next slide, or not getting my slides right, they can feel like it is okay to make mistakes, and it is okay that there's ups and downs. So making sure that they're okay with that, and acknowledging that too as well. Okay, next slide, please. And one of the things I also wanted to talk about was embracing that literacy. So literacy building resiliency. I don't know if you've ever read a book and you were like, I feel empowered. I just finished reading a book by Austin Channing Brown, and I felt so empowered after the book. I loved it. It made me feel really, really good about it. And the same can be said for your child's, right? So numerous studies indicate that storybooks are important for vocabulary development, and they provide linguistic diversity. So there's so much that can be said in picture books. And even though I teach grade 4, every week I'm teaching them from a picture book, and I'm very critical with which books I show the class, because pictured books, they teach values, they teach lessons, they teach history. We have the Viola Desmond Won't Be Budged. We have Counting on Catherine Johnson, who was a scientist, an aerospace engineer, basically. They teach visual and verbal messaging, and they can even influence the child how they see themselves. Okay, so the storybooks have so much power in them. So it's really important to choose the right books, really looking for books that show your child, showing themselves in that literature and showing them in an uplifting manner. That is the key. Solvay, this one here, just books that really promote a higher level and really help to encourage. Next slide. But in the same token, there are some books that we've been reading, and as educators, we've been reading them to our students without really thinking critically about these books. And so it's important too, as parents, to ask your child, what books did you read today? What book did you read? And really thinking critically about them. So depending on the quality of the book, they can reinforce or undermine children's affirmative self-concept. They can teach accurate or misleading information about people of various identities, and they can foster a positive or negative attitudes about diversity. So it is so important to really, if you can't control the narrative at school, what your child is reading, to go back to that book if they've read a book and say, let's look at it critically. So Babar, if you're 80s baby, you might have known this book. This is a book about colonialism, right? And glorifying colonialism. So that's something that they were reading, and we've had it in schools and we read it. And it's important to know that you don't want the same negative messages passed on to your child. This other book, I just bought this book, UV's Candy Tree. It's at the bottom. And it was beautiful. I loved the book. It was of an Ethiopian Jewish girl, and she was traveling out of Ethiopia, traveling to Israel, and she was going through different stages, and it was going very beautifully until when she got on the plane, she said all the white people were angels. So I was a little bit conflicted because, again, I don't want to say that they're not angels, but her only messaging was that the white people were angels, they look like angels, and it really enforced that narrative. And there could have been flight attendants of different races that maybe they could have represented in that book. So I just wanted to be just very careful, like, oh, okay, well, what messaging do I want to give my students where I don't have a majority of white students in my classroom? Do I want to reinforce different messaging? So just being very careful with the messaging, even by Black authors. So in the Please Clean Up Your Room book, where the boy's sitting in a messy room, it's by a Black author, and she's a fantastic author. But in the book, the boy's room is so messy, there are roaches. So again, like reinforcing that, okay, Black people are dirty, they've got roaches, just messages that maybe you don't want to reinforce. We all know Beauty and the Beast, and we love it. We see the movie, but again, these are relationships that are not ideal. This is not a good relationship mix. He's very abusive to her, and she keeps going back. And he's not kind, and he yells at her. And it's you don't want to keep reinforcing those stereotypes. And lastly, I picked the camping trip. And this one, again, you see brown faces and you're like, yes, this is going to be a good book. There's representation, but it was by a white author, and the experience of camping wasn't as authentic as it could have been. So there was no tying your hair when you go in the pool, or it didn't feel authentic. So always, even when your students are reading books or your child is reading a book, really trying to look critically at it and say, okay, what's the messaging that's being reinforced? Because anything that they're putting into their mind is reinforcing a message, a stereotype, things that you just have to be critical of, and it could be damaging at the end of the day. And talk about the book. So what did you read today? What was the story about? Tell me about it. Tell me the beginning, the middle, the end. That's also building comprehension skills. And then when you think this book is not right, my kid shouldn't be reading it, just talking to your child and saying, ooh, why don't you like this book? Or why did this book make you feel happy? Next slide. So does anyone have any questions so far? So, okay, perfect. Okay, so before the end of the school year, so we have 8 more weeks, I'm not counting, but the school year is coming to an end, and it has been an up and down and all over the place school year. So I definitely encourage you to connect with your classroom teacher, your child's classroom teacher, before the end of the school year. Just finding out what were some areas of strength and what were some areas of need that needed improvement. The report card should never be a surprise. You should know exactly what your child is getting on the report card. Have that open and honest conversation with that teacher and just say, what's up? What did we not get through? What did you not really get through this term? That's something that I can work on for the summer. And even asking the teacher for some of the resources that they may have used or things that they can help improve, because it's going to be almost 2 years of an interrupted year. And again, going into another school year, there's going to be a lot of emotional turmoil. There's a lot that's happening for these children, and be realistic with your child and don't expect A's. It's just a letter grade, but just think of areas that may need improvement and something that you can work on, something that you can make fun over the summer, just to kind of keep up that learning. And then there's that big question of in-person versus online. There will be that option for online, I believe, again next year. So online is not for everybody. I know certain circumstances make it that their family needs to be online, but some students are getting a disservice from being online. So just finding out what works for your family and how that comes into play. So online is very self-directed for most of it, right? I have a lot of students who just camera off. I don't even know if they're there. So being able to know that you're listening to the teacher when basically there's no accountability. If your parents are working and your child is just sitting there, being able to sit and pay attention to a screen, a little box, like that takes a lot of work, and that's not for everyone. So knowing what works best for your family, knowing what works best for your child, also tapping into extra resources. So tutoring, if you need tutoring, just other extra things to really help reinforce that learning, because it is very hard online, especially for teachers and students, to really get that quality learning that they may get in the classroom. And being able to meet their physical milestones. So even younger ones who are growing up, definitely they're missing a lot of milestones by just being indoors. So balancing on one foot and their fine motor skills and things that they may have done with the 3 recesses at school, a lot of that is being missed because online learning, there's not as much accountability for you to go outside every recess for you to be playing, unless you as a parent is really strongly enforcing it. So just kind of weighing the pros and cons and really looking at what's best. And like Nicole said, like some students have not, and some children have not even engaged with other children, other peers, other people from outside of their home. So that social piece is huge. I do social breakout rooms every day for my class just so that they can talk to each other on a social level, because they don't know the art of conversation, the art of you say something, wait for someone to respond. I will sometimes get 30 people talking at the same time, and I just have to listen and say, can anyone hear anybody? Because again, like that social presence is not there as much as it should be. So definitely keep that in mind when choosing, and just try to really weigh out the pros and the cons. And next slide. And making most of the break. So this is going to be my summer. I hope everyone's going to be like, this is my summer. Everyone's going to be a hot girl summer or a hot male summer. I can't wait for the summer, because we are finally going to have some restrictions lifted, hopefully, but just taking advantage of being outside. I don't think last year when it all happened, I don't think I really appreciated being outdoors. and knowing that we would be locked down for so long. So really trying to do something every day. This is an activity calendar where it's just different things every day, things that may not cost a lot, like creating a scrapbook or doing a facial mask or painting your nails, or just little things to do every single day, taking a walk, different things, just to make the most of it, because being outside, being in nature is healing, it's therapeutic, and it's amazing. I also encourage to practice basic math skills. So adding and subtracting, dividing and multiplying, practice them, and practice them with your child as much as possible. If you can, make it a game out of it, make it fun, just get them on those basic skills, because again, as teachers, we're just teaching the curriculum and pushing on, right? We don't necessarily spend the time that needs to be spent on core fundamental learning. So definitely try to encourage that. And make learning fun. So if your child wants to learn about ancient Egypt, research ancient Egypt, or really try to make fun out of learning, really try to grow their knowledge and get them interested in learning about different things. And that would help keep that mind active during the summer, and be outside as much as possible if you can. And lastly, getting ready for school in September. That in and of itself is a huge, huge stressor for children. And if they haven't been in school all year, it's going to be even more. So keeping that consistent schedule, especially 2 weeks before you go back to school, going to bed on time, waking up on time, making sure that they have that proper self-care. Remembering that it's going to be uncertain, but it's going to be okay. If they're staying online, having really clear boundaries about screen time and not screen time. I know, like, at the end of the day, like, I can't even look at another screen because my eyes just get so tired, and theirs must be too. And practice. I think one of the things that I learned is just practicing getting up, getting dressed like you're going to school, taking that route that you would be taking to school if you're walking to school, getting them prepared and ready to go, because it's going to be almost 2 years of an uninterrupted school year. So really getting them ready. And lastly, I was thinking about constant check-ins. So checking in with your body, checking in with your child's body to let them know what they're feeling. I don't know if this has ever happened to you, but I will stub my toe or I'll bounce my elbow, and I won't feel it for like 2 days later. And then I'm like, I've got a bruise when I'm feeling relaxed and when I'm less heightened. So sometimes you're so heightened that you will physically injure yourself and not feel the pain. So just making sure that you're checking in and saying, I feel anxious today, or I feel happy, and verbalize that with your child to really, really help go through the motions. And there's more than just the 5 happy, sad, angry, and mad emotions. There's so much more, and label them and be okay that it is okay to be angry. But what are we going to do? How are we going to help take that anger and dispel that anger? How are we going to work with it? So so those are just some ideas just to keep in mind when with the school, everything is so uncertain, but just different things that you can keep in mind to really help your learner to build resiliency, your child. And that's it. Thank you.